or his leg. Say ow somewhere around this area, okay? Ow. Okay. Ow. Okay, so I recognize that there's only one fracture in the femur and it's shaking, so I'm going to say it's a femur fracture. I'm going to put pressure both above and below it, and also like push away because I'm trying to separate the bone.
There are contraindications for using a traction splint. It's basically any other injury on the leg is a contraindication for using a traction.
So when I did my palpations, you should have checked.
I'll go more into that after we show them how it works, because it makes sense to think about why.
Okay.
So what I'm going to do now that Zach has localized the injury is I'm going to measure the side of the bone. And you can unlock it. These are really crappy, so they don't really work that well. But you unlock it and then you pull. And you measure from the iliac crest to about the heel. Longer is better. So if you can't really see it, then err on the side of the ball.
Which leg do you think you're going to measure against?
You're measuring against
the good leg?
The good leg.
Yeah, why?
So you don't move the bad leg on accident?
Well, there's that.
It's really because the leg is going to be shorter. And it's going to be...
Remember, because the bones snap, right? So I'm saying it's coming together, right?
Yeah.
So the leg's going to be much shorter than the other leg.
The sharp bone ends get pulled by the quadriceps, which are the strongest muscles in your body. So they get pulled like this, the bone ends, instead of being like they should. And all the bone, they break, and they get pulled. Your leg gets a little shorter.
Wait, why is it life-threatening? Is it?
There's a lot of...
All right.
Yeah, okay.
Yeah,
So
remember,
why is it
well-
life-threatening?
I'll go
Okay, who can answer that question for?
Just femoral artery, is that?
Yeah, I mean, if you break that, you could bleed out. You could die.
More bleeds 2 minutes, right? Less than 2 minutes.
Okay, that's a very important
A
artery.
minute, right? Remember, because the femur is a really big bone, right? And it's right next to the femoral artery. So if the femur breaks, you have nice sharp edges right next to the femoral artery, right? So once again, this is why it's so important. Because if this patient is moved or anything happens, you know, if those bones nick the femoral artery, you get a huge femoral bleed, density, big problem, and
Anybody know how many liters of blood are in your body? For an average person, average
Liters? It's 20.
5 to 6.
This is a trivial pursuit.
Everyone hold your thumb up. Look at your thumb. That's how big your femoral artery is.
Oh, wow.
How long under pressure do you think, because you have blood pressure, right? Which is significant. How long under pressure do you think it's going to take to pump 5 liters to there?
About a minute.
Not very long. And it doesn't take much. If you lose about 10% of your blood volume, let's say, or whatever, give it 20%, you're going to start showing signs of shock, which are hypoperfusion, hypertension,
pressure,
hypoxia, all bad things. So everything else starts working poorly. Your ability to clot decreases because you start getting colder. So it just starts a really bad downward cycle. So let's just not break the femoral artery. That's a good plan.
So one thing I'm doing right now, I actually release my pressure. You would never do that. The moment you put pressure and you put pressure on the leg, you will never let go, ever. Okay? You don't.
So you're measuring from the hip to the heel. Make sure it's definitely no shorter than the ankle. And err on the side of long if you can. And while I'm here, I'm going to lock these. I'm going to start measuring the straps out. You want 2 above the knee and 2 below the knee, and you want 1 above and below the injury. And make sure that your straps are all just crappy.
Yeah. Our groin strap is actually broken, so we have gavottes on there.
Make sure your straps are all undone, because it makes it easier when you are putting it on the patient.
It would literally save you 5 minutes.
Yeah.
Like,
Prep with this and the backboard, which we'll learn about tomorrow, prep is pretty much the most important thing because it saves you time. So I'm going to move this
can
over
you move your
to
leg over a little more? There you go.
the patient. I'm going to check PMS.
What is Zach doing right now? What's that called? Can you mind that?
let them know.
Manual stabilization.
So it's important what he's doing is he's holding above and below the injury. He's holding those, remember those bone ends I talked about? That were like this? He's holding them because what's going to happen is the leg is shaking, right? Because the muscle is contracted. There's nothing holding the muscle in traction, which is what the bone would normally do. So it's shaking. So he's holding them so they don't shake around too much and hit that artery because they have sharp ends. So once he starts that, once he finds that injury, he can't do anything else. He's stuck there.
Exactly.
Until Lauren gives him a little help. So that's his job, is to sit there just like he is. He's got good pressure on that thing. Really, he's not a real person. He's going to put as much pressure on there as he
Yeah.
possibly can.
I'll put as much energy as I possibly can into stabilizing this. Right now I'm not, because
Alright, also guys, quick
Yeah,
question.
you'll hurt them.
So, right now Zach's holding down manual stabilization, right? So he's basically putting tension on those bones now, right? With his force to keep those bones in place, right? Let's say Zach were to let go of manual stabilization, what would happen? Exactly, right?
Well, they're not even like this right now.
No, they're just like this.
They're still like
Exactly.
this, but they're just not shaking
Yeah.
anymore.
So if Zach let go, once again, you'll cause a lot more problems yet. So make sure once you hold on to manual stabilization or manual traction later, don't let go of it. Alright?
Alright, so I'm taking PMS on the foot.
you would take the shoe off if
I
you
would-
can easily
yeah.
remove, or trauma
Well,
care.
actually, in real life, you would
Yeah,
take it off.
yeah.
Here,
Trauma
if you can take the shoe off, then just take it off. You feed the ankle hinge under the natural arch of the ankle, I suppose.
Yeah.
And then you,
And before you tighten it, you can do it from above, you don't have to get down there, just undo it. So just undo it, put that above it, and then tighten it. Oh, okay. So when you have a femur break, I'm going to automatically palpate that area, and then I'm going to hold stabilization. Before Lauren sets up any of the traction splints, she wants to make sure there's no other life-threatening injuries going on with him. So she's going to perform a physical on the upper trunk before she begins setting up the traction splint, okay? And if there's another life-threatening injury, then she will treat it, and then we'll continue this.
Yeah, so only head and trunk, and that's it. Once that's cleared, then you go and help your partner with the femur fracture. Alright?
okay. So I'm going to apply manual traction. I'm going to grab the end of the foot, or grab the ankle, and pull back. And this is going to move the bones apart.
Okay, and then when she has it, I can finally let go.
And I'm going to say manual traction applied. That way he knows that he can let go.
Now, right about here is where your patient is going to start feeling relief, because you took those bone ends that were like this, and with her pulling on the end, you brought them more like this. It's close to where they should be. Obviously, they're still broken. There's still going to be inflammation and all that good stuff that's really going to hurt, but he should feel a noticeable difference.
Slight relief in pain, yeah.
Okay, so before I'm gonna put this underneath, I'm just double checking to see if all my straps are good to go, because once it's underneath there, I'm not gonna remove it. You wanna prop this up, you pull this out, and you prop it up, and you let it go. Alright. And then you wanna put this down as much as behind much as possible. You pretty much should be sitting on it.
Yeah, it's going to be
It will be very uncomfortable, so whoever is patient, be prepared.
You're going to get it pretty much right under their butt cheek. Is how far up you want.
I like him having a dry stretch.
Right, yeah,
Because
This is not
extrication, there was dashboard, it was kids in
I'm just trying my other
Is that
leg.
good?
So-
Can you see
No,
that?
it needs to be a little further. Can you prop yourself up?
Yeah, just prop yourself up. Okay, there we go.
No chance bringing that back. They
That's
cut it
right.
off.
This will not feel comfortable.
Okay.
When you're patient, it's just.
Yeah.
So the moment I put it on there, I'm going to, this would be a normal strap, going strap, I would tie this off first.
And they couldn't have seen it. They were
Yeah,
no-
Remember, this is when you do the groin strap first. It's kind of
Correct.
counterintuitive because you usually do distal and proximal, but you want to attach the groin strap first.
Okay, so that's as tight as I can get it. I can't get any more, so you should be going that far. Alright, and then I would go, what's this head happen?
That comparison, it should be close to the length of his other leg. I mean, obviously his leg's not broken, so it's not gonna change anything, but a broken leg, it's gonna lengthen it up again.
Yeah.
Cause remember, it's pulling on that bone, that's what it's doing.
Keep in mind that Zach's applying 2 straps below the knee and 2 straps above. The 2 straps above the knee will be above and below the injury.
You guys understand how it works, right? It's pulling, so.
Alright, and then I would recheck PMS.
Yeah. Only when he's done with all the straps can I let go.
Yeah, Lauren cannot let go, or
Yeah.
responder holding manual traction cannot let go unless
And so,
all
all
the straps.
6.
Yeah.
Okay, there's 4 for the leg, there's the groin, and the ankle strap. And then I would recheck PMS.
What's that called when that's set up? You should tell them.
Mechanical
Yes.
contraction.
So we applied manual, once we set it all up, it became mechanical, and then he's ready to be scooped and gone.